So in order to understand why so many African Americans are dying, it's important to see why this group is more likely to contract COVID-19 in the first place. What do you see as the biggest contributing factors?
Clearly, race is not a contributing factor in a sense of the disease does not discriminate. However, our past policies have. And so past policies put black people in substandard housing, created health care inequality, and certainly helped accelerate poverty. All of those factors are concentrated in black areas, and that allows for the virus to spread rapidly in those breaks in the community.
So what do you think the pandemic then is overall highlighting about the existing health disparities?
Well, it's uncovering what we've always known in black communities, that policy has not served the black community well, that past discrimination still is present in today's outcomes. Until we deal with the structural inequality in the U.S., every tragedy we face will see these underlying conditions appear. And so it's not a surprise. After Hurricane Katrina in New Orleans, after the housing bubble, after the tech bubble, these same effects occurred. The black population, as was noted in your prior segment, the black population suffers whenever there's an economic shock to the country. And I just need to point this out. Black wealth is only a tenth of white wealth. And so when you don't have that buffer of wealth in this country, and you don't have a job that supplies health insurance, an event like this can really take you back physically, mentally, and economically.
And certainly will affect your ability to be more upwardly mobile and trying to gain more wealth. Now, we saw that in New York City, officials said that black and Latino residents are dying at twice the rate of white residents. In Chicago, more than 70% of virus-related fatalities were among African Americans. That's more than double their share of the population. Where else are we seeing similar figures?
New Orleans, Detroit, Georgia, parts of Georgia. Here in Washington, D.C., where I am, the rates are as high as 70%. So it's all over. And it is important to also note that in the wealthy white areas of the country, particularly in New York, you're seeing the lowest rates of coronavirus spread. You're also seeing rich neighborhoods getting tested more than low-income black neighborhoods. So all of these factors contribute to worse outcomes for the black community.
So as we saw, even New York's Governor Cuomo saying, you know, we see this information now. What can these cities actually start doing now then to decrease those figures?
Well, ultimately, we need to use this short-term emergency to develop long-term solutions. So we should be figuring out ways to provide universal health care. We should be finding ways to reduce the racial wealth gap. And obviously, we should, in this moment in time, be testing low-income black neighborhoods at the same rate as their white neighbors. It's inexcusable that we don't know who has the coronavirus at this point in time. Folks who have to work need to be tested. And so we have to figure out a way to test people, the bus drivers, the grocery store clerks, the healthcare workers who are on the front line. So if they are sick, they can go home, and those who've had the disease can go back to work. But until we invest in black and brown communities, we won't get to that level of efficiency and quite frankly, justice.
Indeed, and we are seeing that the Latino community also disproportionately affected by the pandemic. Now, the Congressional Hispanic Caucus is calling on legislative leaders to include salary, social safety net, and immigration protections for farm workers in any future coronavirus relief packages. But they're facing a lot of pushback. Why do you think that is, and what will it take to get over that hurdle?
Well, in the United States, we do not respond to black and brown suffering. We typically respond to white suffering. And so certainly the $2 trillion package that was released, we found that money to support workers, and by workers, we've known for quite some time the black population has been in a recession for quite a while. But as soon as this impacted the white workers in the economy, we found money to address that problem. We need to also state that the black community is suffering from past policy, and we need to correct those policies, and we need to fill that racial wealth gap so that people have the same kind of cushion to deal with the next inevitable crisis.
Well, thank you. We do appreciate your insights. Andre Perry there from the Metropolitan Policy Program at Brookings Institution.